Welcome back to my channel. Today we are working on domain 2. If you are preparing for your PHMP ANCC exam, this is a place to be. If you have not followed me, follow me and on your subscribe and on your notification button so that you know when I drop my videos. Today, like I said, we are doing domain 2, PHMP ANCC practice questions. We have our domain 1 on the channel. If you have not checked out those, it's very, very important for you to check it out if you are preparing for your board exam. Those practice questions will help you. We have questions, we have the answers, we have detailed rationales that will help you understand the content, and also we have exam tips. So try and check out this. Remember to subscribe, remember to comment, share, and invite others to join this. We are here to make your study easy. So let's go. We're going to do this together. The first question says, a patient with panic disorder asks why breathing exercises are recommended. What is the primary purpose of diaphragmatic breathing in panic management? So we have rationale, we have our options. A says reduce muscle tensions. B says increase oxygen saturation. C says interrupt sympathetic arousal. And D says enhance mindfulness. Let's look at the correct answer. But before I review the answer, can you put your answer in the comment section? What do you think? The correct answer is interrupt sympathetic arousal. If you chose C, you are correct. So let's look at the rationale together. In panic disorder, the body goes into fight or flight state with tachycardia, rapid breathing, sweating, and adrenaline surge. So diaphragmatic breathing, which is slow, deep breathing, activates the parasympathetic nervous system, and this acts like the body's natural brake system. So it slows the heart rate, reduce psychological intensity, and helps stop the panic escalation cycle. So instead of treating emotions directly, it calms the nervous system so that the mind can regain control. Look at the exam tips. When you see panic plus body symptoms, think calm the nervous system first. Breathing calms is equal to parasympathetic activation, which interrupts panic cycle. So question 2 says, a patient with depression says, I am useless. Which therapeutic technique is the most appropriate first response? A, confrontation. B, reflection. C, interpretation. D, advice giving. Please put your answers in the comment section. What do you think? If you chose B, reflection, you are correct. So here we have that reflection acknowledges the patient's feeling and shows understanding without judgment or premature problem solving. Early in treatment, the priority is building trust and emotional safety, not correcting their thinking. So reflection gives the client permission to express feelings and set the foundation for future cognitive restructuring. So our exam tips here say in early sessions, validate first, intervene later. When you are seeing a patient in their early session, in the early sections, validate first. You have to validate patient feeling before you think of intervention. Reflection strengthens rapport. You need to understand this. You need to remember this. Reflection strengthens rapport. A patient refused medication due to cultural beliefs. What is the best initial provider response? A says educate on benefits. B, document refusal. C, explore meaning of belief. D, offer a different medication. Can you put your answer in the comment section, please? The correct answer is C, explore meaning of belief. Before educating or persuading the provider must understand the cultural, spiritual, or personal meaning behind the belief. Exploring prevents assumptions, respects autonomy, and helps identify real barriers. Once trust and understanding are built, then education or alternative options can be discussed. This is cultural competent care. Remember that NCC likes cultural competent care because these are real situations that you will also face when you become a provider. So you need to know what you should do, what is the best option. The best here is that you have to explore. You need to explore the reason first. When our exam team say when culture refusal appears on exam, first step is to explore. Don't educate yet. Explore the meaning, explore the reason. What is the reason behind the refusal? Is there any meaning? What is their belief? You have to explore that before you begin your education. A patient says, I don't think therapy can help me. Which CBT techniques is most appropriate? A. Thought stopping. B. Cognitive restructuring. C. Exposure therapy. And D. Behavior activation. And you put your answer in the comment section, please. If you chose cognitive restructuring, you are correct. Cognitive restructuring teaches patients to identify negative thoughts, challenge them, and replace them with more balanced, realistic beliefs. So if a patient doubts therapy or feels hopelessness, the goal is to help them recognize all or nothing thinking and replace it so engagement increases. So CBT is all about restructuring, targeting the negative thoughts. Exam tip: hopelessness, negative beliefs, therapy won't help me. Think CBT. Think CBT, cognitive restructuring therapy. So, number 5, which interviewing technique? Which interviewing technique promotes self-motivation in motivational interviewing? A. Persuasion. B. Open-ended question. C. Confrontation. And D. Advice giving. Which interviewing techniques promote self-motivation in MI? Okay. Put your answers in the comment section, please. Open-ended question. And motivational interviewing focuses on helping patients find their own reason for change. Look at, I put on in capital letter because you are helping this resident, you are the patient, you are helping the patients to find their own reason for change. So open-ended questions encourage deeper response, promote reflection, and increase intrinsic motivation. This moves behavior change from provider driven to patient driven. You are only guiding this patient to find the reason why they will want change within. So that motivation has to come within. So you need to ask open-ended question to help them to reflect and to increase the intrinsic motivation. Exam tips: MI loves OARS, open questions, affirmations, reflection, and summaries. Open questions motivation helps motivation to grow. Next question. A patient says, I hear voices, but I am not crazy. What is the best therapeutic response? This question, this patient is in denial. He says, ask details about the voices. Confront the delusion. Tell them it is common. Ignore the comments. What do you think is the correct answer here? Put your answer in the comment sections, please. The correct answer is ask detail about the voices. So exploring hallucination calmly allows assessment of frequency, content, the stress level, and safety. So you have to assess first. This patient is complaining, says he hear voices. You have to explore. You have to ask about the details of the voice. What is the voice telling you? Exam tip: psychosis on exams, assess first. Explore symptoms before challenging or measure or reassuring. You have to explore the symptoms because you don't even know what this voice is. Even in practice, you need to explore these symptoms. What is the voice telling you? Is this voice telling you to harm yourself or harm another person? Are these voices commanding or are they like friendly? So you have to explore. This is, remember that everything, nothing is all about assessment. You need to assess before you can intervene. A patient with PTSD avoids trauma reminders. Which treatment is most effective? This patient has PTSD, but this person he doesn't, or he or she doesn't want you to anything that will remind him or her about the trauma. Which therapy is most effective? A. Exposure-based therapy. B. Psychoeducation alone. C. Supportive therapy. D. Thought stopping therapy. What do you think? Put your answers in the comment section. Exposure-based therapy. This is because exposure-based therapy gradually helps the brain learn that previously feared stimuli are not dangerous. So it reduces avoidance and retrains the fear response. So when you see PTSD plus avoidance, think about exposure. That is the gold standard. Don't choose supportive therapy first. Exposure therapy, the gold standard for PTSD and avoidance. A patient frequently changes the topic when discussing substance use. What technique is appropriate? A. Confrontation. B. Redirection. C. Interpretation. D. Empathic reflection. What do you think? Put your answers in the comment section. The answer is redirection. Why do you need to redirect? When patients avoid difficult topics such as substance use, direct confrontation increases resistance. Redirection gently brings the patient back to focus. So keep therapy structured and reduce defensive while maintaining empathy and engagement. The exam tips: avoidance in therapy, redirect gently, don't confront harshly. Remember this. If there is avoidance in therapy, you need to redirect gently, don't confront harshly. A client says, I failed as a mother. What is the most therapeutic response? A. Why do you think that? B. You shouldn't feel that way. C. Tell me what makes you say that. And D. That is not true. Can you put your answer in the comment section, please? Tell me what makes you say that. This is because the response encourages elaboration and gives emotional permission to share deeper feelings without judgment. Without judging, it avoids invalidating statement like that is not true and avoids why question that feels like accusatory. It also opened the door to understanding cognitive distortions like guilt, shame, or unrealistic beliefs. In the exam, we have exam tips. When a patient expresses self-criticism, invite them to elaborate. Don't correct them or dismiss them. Okay. Which skill is foundational to establishing a therapeutic alliance? Which skill is foundational to establishing a therapeutic alliance? A. Interpretation. B. Empathy. C. Confrontation. And D. Advice. Put your answers in the comment section, please. empathy. Empathy communicates emotional understanding and makes the patient feel seen, safe, and valued. So, even research consistently shows that empathy is the strongest predictor for successful therapeutic outcomes more than techniques alone. In your exam, building alliance, if you see building alliance, remember empathy beats confrontation, advice, or interpretation early in care. So you have to employ empathy during the early stage of your therapy. It will always beat confrontation or advice or even interpretation during the early care. A patient with poor insight refuses treatment. What is the best? What is the first step? A. Explain diagnosis again. Assess decision-making capacity. Call security and document refusal only. Can you put your answer in the comment section, please? If you chose assess decision-making capacity, you are correct. Remember that I said earlier that you have to assess. We are nurses and we always, the first step is assess. So before accepting refusal or forcing treatment, the clinician or the provider must determine whether the patient has the ability to understand information, appreciate consequences, reason about choices, and communicate a decision. Capacity determines whether treatment refusal is valid or whether legal safety steps are needed. So you need to assess the decision making capacity. Exam tips: safety plus refusal. Capacity first. Everything else follows. You have to assess the capacity. Does this person have capacity to make this kind of decision? The patient says, I want to quit drinking, but I don't think I can. What MI technique should you use? A. Affirmation. B. Confrontation. C. Advice giving. D. Closed questions. Remember that ANCC, they like MI questions because even in practice, this is what you'll be doing. You will be dealing with people that have addiction problem, and we need to employ MI technique for this patient. So you need to know this for your exam, and you also need to know this for practice. So put your answers in the comment section. Affirmation. Affirmation reinforces patient strength, effort, and success. This builds confidence and self-efficacy, which are essential for change. So when a patient feels discouraged but still wants change, acknowledge efforts helps them keep trying. If you acknowledge their effort, if you acknowledge that they even want to change, it will help them and help them to keep trying. Exam tips: low confidence but desire to change. Affirmation boosts readiness. A patient becomes tearful while discussing trauma. What is the most appropriate response? This patient is discussing trauma and he became tearful. What is the most appropriate response? Change the subject, sit quietly, allow expression, continue asking questions, tell them to calm down. What do you think is the correct answer? Please put it in the comment section. Sit quietly and allow expression. So emotional processing requires a safe space. Silence can be powerful and therapeutic. So signaling presence and acceptance. Rushing, distracting, or telling the patient to calm down interferes with healing and may shut them down emotionally. Exam tips: tears in sections, hold space. Silence is a therapy too. So employ silence and allow them to express their feelings, their emotions. Which communication style reduces resistance in motivational interviewing? 1. A. Directive. B. Judgmental. C. Collaborative. D. Authoritative. Which communication style reduces resistance in motivational interviewing? Put your answers in the comment section. Collaborative. Motivational interviewing is based on partnership and respect. So collaboration reduces resistance because the patient does not feel controlled. Instead, the patient becomes an active participant in change, increasing motivation. During the exam, if the tone sounds team-based, respectful, and shared, it is motivational interviewing. A patient repeatedly misses appointments. What is the first step? A. Discharge patient. B. Explore barriers to attendance. C. Warn about policy. And D. Reschedule without comments. Put your answers in the comment section. Explore barriers to attendance. The correct answer is explore barriers to attendance. Missed appointments often reflect fear, logistical barriers, depression, or ambivalence. So before enforcing rules or discharging, the provider should understand what is getting in the way. Addressing barriers improve engagement and outcomes. Exam tips: non-adherence. First, ask why. Asking why is just like assessing. Remember, see, I keep hammering on assessing. When you are trying to find out why something is not happening, you are assessing that situation. So remember, if a patient is missing appointment, you need to first of all ask why. Why is it happening? Is there any way? What is in the way? Is there any changes? Is it transportation problem? What is in the way? So you need to assess first. Never punish before understanding. Remember that. So I'm having a technical problem, so I'm going to stop this domain 2 question. We answered from number 1 to 15, and we will continue in the next video. If you have not subscribed to my channel, like I said, this is the time to hit subscribe button. Remember to on your notification button so that you will know when the next video drops. You can share this video, invite others to join. Like I said, we are here to make your studying easier. We are going to walk through this with you. So we are preparing these questions so that you can have a knowledge and a knowledge of what to expect in your exam, and this can also help you with the content. You can take your pen and paper and write down the content. This content is rich. The rationales are rich in content. This will help you to understand and reinforce the content that you have been studying. And I wish you the best of luck in your exam. See you in my next video.